As we continue to spend so much of our time here working from home, it is so important that we continue to focus on our health. That's why we're continuing to check in with 9 Health to stay up to date about the latest information about COVID-19.
Gary, Dr. Kohli, thank you both so much for joining us on Colorado and Company. Gary, I want to go ahead and start with you first. So the 9 health fairs, unfortunately, were canceled this year, but now people can get all the screenings that they would usually get, plus that COVID-19 antibody test, which is called the 9 Health Discovery Kit. So tell us a little bit more about that Discovery Kit and what people will discover, if you will, about themselves.
You bet. Thanks for having us on. We did, unfortunately, have to cancel the health fairs. There's typically about 100 of them around the state, but we pulled them down for now, and we've put the same screenings that you can get at a health fair available through both mail order and at a Quest service center. Now, what that enables you to do is get that your preventive screenings at the same time you might get a COVID antibody screening. And as we have come to learn, many of the chronic diseases and health issues around our immune system do affect COVID. And we also have some free online screenings, especially around mental health and some of the preventive things that we need to keep in mind, even though we have this virus going on.
Sure. And, we're talking to Dr. Kohli. There's a lot of confusion about COVID and the antibody test right now. So who should be looking to get this test, and what are some of these benefits that we can get from it?
That's a great question, because the test is really not meant for every single person in the general population. It is actually meant for those who are intermediate to high pre-test probability of being positive. So let me give you some examples of what that means. So if you're somebody who had symptoms over the past 6 months, but because of lack of testing or lack of availability, you weren't able to get a test, but you're wondering if that was COVID that you had, you would be a great candidate to go for the antibody test. If you were somebody who had an exposure or works in an environment where you're high risk for exposure, you're a healthcare worker, a police officer, you work in a nursing home, or you work with people who've had COVID, then you would be a great person to know whether or not you've already had COVID. And then, of course, these are individual benefits, but there's also some community benefits as to why you might want to know whether or not you are antibody positive. The first is because it really helps the Colorado Department of Public Health understand where the virus has been in our community. And then the second is because your antibodies, if they're there and the antibody test comes back positive, may actually be used to help someone who's critically ill with COVID in a therapy called convalescent plasma or convalescent serum. Now, this therapy is still under investigation, and scientists don't yet know whether it works to help treat COVID, but it is something that we're using, and we need more donors in order to try to use that therapy. So if your test comes back positive, you could potentially be a donor, give your plasma to somebody else and help them as they're struggling with the illness.
Wow. So it could be really beneficial for others too, to potentially get that test. Now, Gary, we've talked about 9 Health Neighbors, that program as well. But how does that fit into all of this new wellness packages that you guys are offering?
Great question. A lot of folks don't have access to a doctor or medical professional at this point around the state for any number of reasons. And thanks to the generosity of hundreds, if not thousands, of medical volunteers that help us out with health fairs each year, they are now helping us out online and on the phone.
Well, Dr. Kohli, in addition to the antibody test, we also mentioned that there are regular preventative 9 Health blood screenings. So what are some of those screenings, and why are those so important?
Now more than ever, it is critical to really focus on our preventive health, because we're learning that a lot of these screenings can actually alter your susceptibility and your risk of complications from COVID. So I would strongly recommend doing these 9 Health preventive screenings. And what's great about them is that you can really customize them according to what your needs are, what your medical problems are, what medications you're taking, your risk factors, and your age. And this is called the 9 Health Discovery Kit. And you can really design a customized panel of screenings that you can get. I would recommend the chemistry screening, which looks at 28 different parameters, including kidney function, thyroid function, your TSH, which is the thyroid, your hemoglobin A1C, which tells us about diabetes. We also look at factors like vitamin D deficiency and other vitamins, hormones like testosterone levels, and inflammatory markers like high sensitivity CRP. So a number of different parameters that tell us so much about your health and help us to identify the disease before it starts to cause symptoms, by which point it's too late to really change the course of what's already happened.
Sure. It sounds like such a great way to really make sure that you're staying healthy in an easy and convenient way without leaving your home. So, guys, thank you both so much for joining us today on Colorado and Company, and we really look forward to hearing from you both in the future.
You can go online right now to 9healthfair.org for more information. And if you have questions, 9 Health Neighbors is still up and operating with volunteers standing by to answer your questions. So give them a call at 303-698-4455, extension 2005. And make sure to tune in all month as Dr. Kohli addresses specifics about COVID-19 and what we can all do to stay safe.